International Society for Sports Psychiatry, or better known as the ISSP, aims to carry the science and practice of psychiatry to the athletic community. My name is Roy Collins. I'm a psychiatry resident at Stanford University and former collegiate football player from Yale University.
And my name is Somto Obi, a psychiatry resident at Baylor College of Medicine. This is the ISSP podcast, conversations around the intersection between mental health and sports.
Hey, sports psych friends and fans. Today it's actually just going to be me, Roy, as my co-host Somto was out doing his busy residency stuff and won't be able to join us today, but I think you're really going to enjoy this conversation. You know, the whole reason why we came into this profession of sports psychiatry in the first place is because we want to help athletes reach their peak performance when they train and ultimately compete in matches. But what if they're overtraining en route to doing so? You know, overtraining is this concept that doesn't really apply much to former elite athletes or non-athletes, as we all just need motivation to get up and exercise in the first place. But for elite athletes, they certainly run the risk of overtraining, which is training / competing to the point where the performance actually suffers. And so for this topic, I wanted to bring in someone I consider to be a friend and a mentor, Dr. Danielle Kamis, who herself was a collegiate athlete and is now a renowned sports psychiatrist, to talk about this topic. We want to talk about not only what the risks are of overtraining, but how you can identify and ultimately help someone whose performance may be declining secondary to overtraining. So hope you all enjoy the conversation. All right, and for our next guest, who I'm really excited to talk to, we have Dr. Danielle Kamis, who is a former collegiate fencer, who is a 4-time NCAA championship qualifier, captain, and All-American from the University of Pennsylvania. She completed her residency in the Department of Psychiatry and Behavioral Sciences at Stanford University School of Medicine, which is a very prestigious and honorable program, where she is now an adjunct clinical professor. She's now a board member with the ISSP and leads the communications division. And she co-edited the first book of its kind, the Manual of Sports Psychiatry. So thank you so much, Dr. Kamis, for joining us and talking to us about overtraining in sports. But before we go into that kind of subgenre, I want to just get to know you a little bit better. How did you find yourself in sports psychiatry in the first place?
Absolutely. Well, thank you, Roy, for that awesome introduction. I mean, obviously, like you said, I was an athlete from a young age growing up, and so obviously could kind of connect with scholar athletes. And when I started my residency, my first year, I had a patient on the inpatient unit who was a pretty high level runner, and I just kind of noticed that there's a whole other area of specialty and like room for connection with people that have also kind of balanced like high level performance and athletics with school. And I felt like I just had this connection with this patient that maybe other physicians didn't have. And so it really drew me. And then I kind of, during the residency process, tried to find and create a pathway in order to get more exposure to working with athletes. And so, during my time in my residency at Stanford, they just started opening and developing a sports psychiatry, program and clinic there. So I was able to kind of work with sports psychologists and, they're either in the athletics department or in the PsyD program, as well as sleep medicine doctors that work specializing with athletes. And, formed a team where we would meet every other week working with the Division I athletes at Stanford. And that kind of, I think, helped propel me forward, and was able to work with a wonderful professor emeritus named Dr. Ira Glick, who has been my mentor, I would say. And during that time, wrote this book, Manual of Sports Psychiatry, with the International Society for Sports Psychiatry. And I think that, for anyone who's wants to be more involved, a fantastic organization that has people from all over the world, psychiatrists that are passionate about working with athletes. And, and since that time, I just really have tried to reach out and, work with people either from high school age or those who want to be training on more national levels in many areas of sports, and trying to learn the intricacies of each sport and how psychiatry is applied to that, and how we can be helpful to athletes and help optimize their training and performance. So it's been, it's kind of like the new realm and area of psychiatry that's being invented as we know it. And it's been kind of pretty exciting to be part of the field.
It's super exciting, and we're happy to have you, someone who, again, co-edited the manuals for psychiatry. I mean, even saying the manuals for psychiatry is pretty daunting. For those of us who haven't yet purchased the fine book available on Amazon, can you tell us what consists of the manuals for psychiatry?
Absolutely. So the book is basically developed for anyone who's working with athletes that wants to have a better idea of, what should a psychiatrist or coaches or therapists be looking for in a specific sport. And so we basically found psychiatrists that had specialties in, either we kind of organize it in combat versus non-combat sports and individual versus team. And basically getting a better idea of what sort of psychiatric diagnoses are more prevalent, what are like in terms of like eating disorders, substance use, what are the things that you need to look out for each sport and the different treatment modalities. So there hadn't really been a book written about that previously. So we were pretty excited to get that published.
That sounds like a pretty big overhaul, but happy again to have the co-editor, talking to me as we get to learn together, what exactly this field is and where it's going.
Yeah.
Very exciting.
Absolutely. Thanks for having me.
So based off of what I know about you, and the quiet secret here is I know Dr. Kamis fairly well.
Yes, you do.
I wanted to talk to you about specifically overtraining in sports. We hope that this series covers multiple different topics that are relevant to those of us who provide care to athletes, but also athletes themselves. And so one of the fairly underrated topics within sports is those who train too much, right? You think about those who don't train enough and who aren't reaching their goals, but overtraining is an underlooked aspect of that.
Absolutely.
So when you think about overtraining, how might somebody identify someone who, generally speaking, is overtraining?
Yeah. So basically, obviously, when we try to increase our performance, we have to kind of increase our training load, but we have to do that in certain, periodic times and leave ourselves for time for rest and recovery. And this idea is called training periodization. So we have to make certain intervals. So basically overtraining is when we're kind of like accumulating too much of a training load and then kind of having too much of this decrement that we can't make up for, we don't have time to recover for. And so they kind of break it down typically into three different areas. One is called functional overreaching. The other is non-functional overreaching. And then it, to more severe degree is called overtraining syndrome. So I'll just kind of briefly describe which each one of those is. Good. So functional overreaching is basically, it's something short term, only lasts from days to weeks. But basically this is like the healthy recovery. This is how we actually build muscle and become stronger so that we, increase our training, but it leads to this sort of temporary setback. So, but in the long term, after a couple of days to weeks, we have actual improved performance. And so the outcome is something what we want, positive, versus non-functional overreaching, kind of more of a long-term out, like in maybe weeks to months, where basically we have intense training, but it leads to this performance deficit. And that typically there's also some psychological component or other types of bodily, like physiological symptoms that may be contributing, which leads to like the inability to be able to train at like an optimal level. But if this keeps happening consistently, where someone is training, too much and not leaving enough time for the rest and recovery, that's when someone reaches this thing called overtraining syndrome, which basically that they have this like deficit of performance for at least a 2-month period of time. And then usually there's also certain other like physiologic symptoms that have been noticed, either like different changes in their hormones or their immune system. And a lot of times there might be other, situational stressors that might be leading to, mental illness, depression as well. And so this, can last for months at a time and really have a negative impact on the athlete. So that's kind of how we kind of think about it in these three three different subject areas.
Yeah, that's very interesting, especially thinking that there's an entire syndrome, overtraining syndrome. That's what it's
Mhm.
categorized by this. And
Yeah,
I mean, I'm hearing that you said the problems need to last 2 months after.
exactly. Yeah. So basically, I mean, if you're seeing an athlete that has like their performance has dropped from,
Mhm,
even for multiple weeks, that should kind
mhm.
of put up the yellow flag. And then if at least when it goes to like a month or 2 months, that's when like the red flag kind of comes up.
And so when you talk about problems, I'm hearing performance decline. I think you mentioned some psychological problems and physiological issues. I'm wondering if you can, give me more details on what type of problems arise when someone has overtraining syndrome.
Absolutely. So basically, yeah. So in term, obviously their performance decreases, but what's
Mhm,
happening physiologically is a lot of times you'll notice that the athlete will have like fatigue, they'll have low mood or depressive symptoms. They might
mhm,
have a decreased heart rate or bradycardia, and
mm,
like just like a loss of motivation, like they're just not able to do the training that they used to do. And
mhm,
then additionally, sometimes they can have more of like some agitation or irritability, and that might lead to like insomnia or hypertension, like a feeling of restlessness.
mhm,
And then depending, some athletes can also experience like anorexia, changes in their weight or like ability to concentrate, and
mhm,
then increased anxiety, or kind of just like that feeling when they wake up in the morning and they're not feeling refreshed.
mhm.
So those are kind of this most common symptoms of overtraining, but they can kind of, depending on obviously like the gender of the athlete, can kind of show itself in different ways.
Got it. Appreciate that.
Yeah,
In medicine, we think a lot about risk factors, right? We want to know, who should we look out for? You kind of touched on that a little bit already. So thinking about somebody who's maybe performance in for several days or even weeks has started to kind of decline a bit, you want to be thinking about, how maybe they might be at risk of overtraining. So when you think of these
right.
common risk factors for overtraining, what types of risk factors would you going to look out for?
Yeah, so I think the biggest thing is making sure that the athlete has an adequate time for recovery.
Hmm.
That like we said, this in this functional, in the functional overreaching, it's like obviously we have to push our bodies to some point of fatigue, but then we have to let them recover. And so if there's not a sufficient time of recovery, that can lead to the non-functional overreaching, or worse, the overtraining syndrome.
Hmm.
Also, a lot of times, like having too much like monotony in the training, can be
Mm,
really demotivating, and people just, yeah, don't have the same stamina as they used to.
mhm,
Also having like too many competitions where people,
mm.
yeah, aren't getting enough training, or they're just constantly traveling, and not having again time to rest. And then another big one of my sort of specialties that I like to focus on is sleep and having sleep disturbances.
Mhm,
So obviously, like if someone is having difficulty, either if they have sleep apnea, if they're having circadian rhythm changes or issues, um, if they're having insomnia, that can like greatly their performance. And
mhm,
then of course, just like being aware of the athletes like personal life and stressors and things that are going on in their occupation, which is why having like a sports psychiatrist on the team is so important, because it
mhm,
kind of, like this, the point is that a athlete's mental health can affect their physical health and performance. And
mhm,
so staying on top of what is going on in their lives is vital.
mhm,
And then also, like if they've had any other previous like medical conditions or other mental health illnesses that could potentially predispose them, um, and just thinking about anything else that could put more stress on their body. So in addition to
yeah,
like less sleep, if they maybe are working at like higher altitudes, where they're having less oxygen, or like really really hot conditions, that sometimes they'll just bonk out. And so those are just, I think, all really important factors to think about that could potentially trigger this overtraining syndrome that we want to prevent.
yeah. That's really great.
Yeah.
Um, the time of the recording, the NFL draft was just a couple of weeks ago, and I think about the NFL combine that leads up to the draft that kind of lets everyone know, some of the measurables, everyone's height and weight, and their 40-yard dash time, et cetera, et cetera. And
Right.
so, from my own collegiate football experience, the time from the end of the season to the combine is kind of a mad dash in itself, right? You want to all of a sudden just focus entirely on training for this one event, that could potentially earn you millions of dollars. And so
Right.
my question would be, how does one differentiate from just needing to work really hard and overtraining, if one can differentiate?
I think that's a piece of kind of being in touch with your body, like if like trying to measure like what is my energy level, like what is my motivation, like how strong am I feeling, and measuring your performance. Like if you keep training and your performance is getting worse, then it's something to kind of look at, right? Like you might, okay, maybe I actually need to take a break here. Maybe it's too much and I'm not getting the return that I want, even though I'm putting the effort in.
Yeah. So basically everyone's their own kind of individual person, and there's not
Right.
one answer is what I'm hearing, which is always the answer in medicine, right?
Right. Exactly.
Awesome.
Yeah.
Now it wouldn't be right to have a podcast with you and not talk about gender specific considerations. So I wonder if you can enlighten us, Dr. Kamis, on some gender specific considerations over training.
Yeah, absolutely. So there's something that I've been writing a little about, and I do like to focus on gender differences, and typically female gender, and what can potentially come about in overtraining for that specific population. And so there's something called the female athletic triad, which is basically a medical condition that is involved, that can be seen in female athletes, and it involves three main components. So one is typically, there's low energy availability, perhaps with an eating disorder where there's a restricted amount of calories that are coming in. Additionally, the second one is having some sort of menstrual disturbance, usually amenorrhea, when a woman is not having her period. And then third piece is bone loss or osteoporosis. And in this piece, it's the energy, obviously there's always the input and the output. And if there's a difference between these two, we have an energy deficit, which is the main cause of this female athlete triad. And so it's something to really be careful and be screening for, especially if you have female athletes. It typically tends to be in more, aesthetic sports like gymnastics, or like runners sometimes, where like weight is something that is important. But there's also something that has been coming out in new research that's like the gender equivalent in males. Actually, it's called REDS, which stands for Relative Energy Deficiency in Sport. And basically, they're trying to conceptualize a similar set of symptoms that's not just in female athletes. And basically, like if you have an undernourished male athlete that has some signs of like hypogonadism, and thirdly, the impairment in bone health, it's kind of like this other comprehensive model depicting this low energy state in a physically active woman or man. So those are kind of different areas that are important that can be as a result of overtraining and not having enough intake, that and you can really see that there's scary and really significant physical effects from this that are really important to stay on top of, and can have a lot of harm if they're not treated effectively.
Yeah, we talked about weight loss and abnormal periods and bone loss. I mean, these are all pretty major medical conditions for anyone, and specifically for athletes who need everything in their body to be working just so in order to perform the right way. So let's say you have a female athlete who comes to your clinic, maybe one of these aesthetic sport athletes. So these are the weight specific ones. What would you do? What would be some of the treatment modalities you would consider?
Well, I think that, so obviously first having bringing a nutritionist on board, setting up, like trying to measure what is the caloric input and output, and helping make that, making a a nutrition plan for the athlete, and having therapy for that, I think would be extremely helpful. You might have to even limit the amount of output or exercise that the athlete is doing so they're able to recover. Because basically what happens is that, as you probably know, but if there's insufficient energy to fuel the athlete, then they can't maintain the normal bodily processes like in the reproductive system, and so it kind of shuts down to conserve energy, and then the female bodies kind of stop producing this estrogen, which then affects the menstrual cycles as well as the bone mass. So basically the thing to focus on is that inequality in the energy, but in trying to figure out and talk to them, like what are they feeling, what are they experiencing, why is this happening, because like we said, it could be something with their sleep or anxiety or mood that might be affecting, like negative thoughts that are affecting their maybe like how they think about themselves, and which leads them to kind of restricting and feeling like they're more in control, but then leading to this poor outcome and really scary physical like impairments. And so I would just if you notice, or if a patient or athlete tells you that like, oh, I'm not having my period, or like I'm limiting the amount that I'm eating, I would kind of go through these three categories. Obviously with the bone loss, you have to actually have like a DEXA scan for that, but I would really screen for this and get them help, and try to evaluate, like, do they need the sports psychiatrist, sports psychologist, nutritionist, like get them involved with the team.
Yeah, and I would imagine actually, we started this talk about gender differences, but the treatment modality would probably actually be the same for both a male or female athlete, as far as getting them to pull back and also get nutrition involved and kind of figure out, the input, output, and what other, comorbidities are happening at the same time.
Right.
I imagine though, getting someone to pull back on training if overtraining is the syndrome would be fairly difficult, huh?
Yeah, and I think that's why like having an interdisciplinary approach is like so important. Like I think that speaking with the coaches, and obviously if you have permission, would be really important, because like they might have to just forcibly limit the amount of training that this athlete has, not to punish them, but more is to help them, because they can really do severe damage to their body or have significant injuries if they're having osteoporosis that could end their athletic career.
Yeah. Do you have any advice for folks in the training staff or coaching staff, those without the medical background that's concerned about overtraining and an athlete that they are around?
Yeah, I mean, I think the most important part is just like not being scared to bring these sort of questions up and ask about it. Like obviously, even kind of just check in and see like what are they eating, how are they performing, have you noticed any weight changes, and if they, obviously it's a little bit more in the medical area, it can be more personal, but I think that if someone like an athletic trainer is worried, and either they can ask themselves or they can have the athlete kind of referred to the sports psychiatrist to do like a further evaluation. But I would say like to have a low threshold, to get them, more help.
More help is always necessary, and taking that interdisciplinary approach, over communicating can avoid overtraining, right? So we want to make sure that everyone's on the same page and as open communicating as possible. I hear you on that one for sure.
Absolutely.
Okay, so thank you so much, Dr. Kamis, for telling us and educating us about overtraining.
Absolutely.
Before we let you go, and thank you again for sharing your time with us. I want to talk about all the different intersectionality that you represent in this field. So you're a former collegiate athlete, a woman in sports, and also have interest in Jewish athletes as well. If someone shares any of those same backgrounds or is interested in sports psychiatry at all, but it feels intimidated for any reason, what advice would you have for them?
I mean, they're always welcome to reach out to me. I think that what has always been most helpful is to have someone to help walk you through and like mentor you, and I think that like joining ISP or joining, if wherever you're training at has a sports psychiatry or sports psych program, like contacting them, going online and joining ISP, which has like a mentoring program, or just trying to reach out to anyone in your university or academia that you know of that is related to sports. Even if you're like a psychiatrist but you're still interested in those sports psychologists, like it could be helpful to learn from them too, even if there isn't a sports psychiatrist where you are at. But I think finding someone that can help you walk through and navigate the field, and just the other thing, a word of encouragement of like having perseverance, that it might not be easy. It's kind of this new field. We don't have like a necessarily, we're about to have a first fellowship, but it's sometimes it can be a little bit more difficult and a little more treading in an unknown area, but at the same time that's really exciting to get to pave it moving forward. So but I'm always happy to help if anyone is aligned in my kind of like areas of specialty.
It can be very fulfilling to be an early adapter, but it's definitely a road that is tenuous and uncharted.
Yes, that's a good way to put it. Exactly.
All righty. Well, thank you so much, Dr. Kamis, for educating us on overtraining and just giving us a roadmap into sports psychiatry and all your expertise. Thank you for mentoring me and being a friend to me and helping me along and spending your time with me. I really appreciate it.
My pleasure. Thank you so much for having me. Thanks for
where can the people find you?
I mean, you can always just Google my name, Danielle Kamis, and my email will come up there. So feel free to do that, or through my Stanford email. Just shoot me an email.
All right. Well, we'll talk about what we want to include in the info. But thank you again for everything, and you have a great rest of your night.
Thank you so much. Take care.
Thank you so much for watching or listening to our content today. Please like and subscribe to our YouTube and podcast channels and share this episode with your friends and colleagues. Also, follow us at Sports Psych ISSP on Twitter and Instagram, or you can find us on Facebook as the International Society for Sports Psychiatry. Are you a medical student, psychiatry resident, fellow in a psychiatry subspecialty fellowship program, or a psychiatrist who has completed a psychiatry residency program interested in learning more about sports psychiatry? Join us and become a member of the ISSP. We have a free open source certificate of additional training in sports psychiatry program. For more information about our certification program, membership, or other inquiries, go to our website at sportspsychiatry.org.